everyone. Today I'm going to do a presentation on eating disorders. So I'm going to kind of go over the history, prevalence, cultural differences, DSM-4, and then the changes that will be coming in the DSM-5. So starting with the history, then in 1952, the DSM-1 classified anorexia nervosa as a psychophysiological reaction. The DSM-2 considered anorexia under special symptoms which included feeding disturbances, and binge eating was first recognized in 1980 with the DSM-3, and the revised version in 1987 included the term bulimia nervosa. There is a 9-to-1 gender ratio from women to men to have anorexia nervosa. A national sample population showed that women over age 18 are 0.9% likely to have anorexia nervosa, 1.5% to have bulimia nervosa, and 3.5% to have binge eating disorder. The prevalence in men is 0.3% to have anorexia nervosa, 0.5% to have bulimia nervosa, and 2% to have binge eating disorder. Some of the cultural differences include African American women are less likely to be at risk for anorexia nervosa or bulimia nervosa. Women of color are less likely to be diagnosed with an eating disorder, even when their symptoms are consistent with the qualifying diagnosis. Binge eating and binge eating disorder is either equal or possibly greater in African American women compared to white women, and studies have shown that there is concern regarding African American women seeking treatment and it being significantly lower than among white women accessing treatment. Binge eating has shown to be higher with Latinas compared to whites or African Americans, and Latina girls are more dissatisfied with their body than white girls. For the DSM-4, the criteria for anorexia nervosa, it includes refusal to maintain body weight at or above a minimally normal weight for age and height, intense fear of gaining weight or becoming fat even though underweight, disturbance in the way in which one's body weight or shape is experienced, undue influence of body weight or shape on self-evaluation, or denial of the seriousness of the current low body weight. In post-menarcheal females, amenorrhea, which is the absence of at least 3 consecutive menstrual cycles. And so with anorexia nervosa, you're going to have to specify whether it's restricting type or binge eating / purging type. So with restricting type, it's during the current episode of anorexia nervosa, the person has not regularly engaged in binge eating or purging behavior. And for binge eating / purging type, it's during the current episode of anorexia nervosa, the person has regularly engaged in binge eating or purging behavior, which includes self-induced vomiting or the misuse of laxatives, diuretics, or enemas. And for the DSM-4 TR criteria for bulimia nervosa, and the code for that one is 307.51, so they have to have A, recurrent episodes of binge eating, which is an episode of binge eating is characterized by both of the following. So you'll need 1 and 2 if you're looking at the PowerPoint. 1 is eating in a discrete period of time an amount of food that is definitely larger than most people would eat during a similar period of time and under similar circumstances. 2, a sense of lack of control over eating during the episode. And B, recurrent inappropriate compensatory behavior in order to prevent weight gain, such as self-induced vomiting, misuse of laxatives, diuretics, enemas, or other medications, fasting, or excessive exercise. C, the binge eating and inappropriate compensatory behaviors both occur on average at least twice a week for 3 months. And D, self-evaluation is unduly influenced by both body shape and weight. E, the disturbance does not occur exclusively during episodes of anorexia nervosa. And for the same, you're going to have to specify whether it's purging type or non-purging. So with purging type, during the most current episode of bulimia nervosa, the person has regularly engaged in self-induced vomiting or the misuse of laxatives, diuretics, or enemas. In non-purging type, during the current episode of bulimia nervosa, the person has used other inappropriate compensatory behavior such as fasting or excessive exercise, but has not regularly engaged in self-induced vomiting or the misuse of laxatives, diuretics, or enemas. And then the next eating disorder criteria is eating disorder NOS. so not otherwise specified, and that's 307.50. And so some examples, this would be the eating disorder NOS categories for disorders of eating that do not meet the criteria for any other specific eating disorder. Some of these examples include, for females, all the criteria for anorexia are met except that the individual has regular menstrual cycles. 2, all the criteria for anorexia are met except that despite significant weight loss, the individual's current weight is in the normal range. 3, all the criteria for bulimia are met except that the binge eating and inappropriate compensatory mechanisms occur at a frequency of less than twice a week or for a duration of less than 3 months. 4, the regular use of inappropriate compensatory behavior by an individual of normal body weight after eating small amounts of food. And 5, repeatedly chewing and spitting out but not swallowing large amounts of food. And 6, binge eating disorder would be recurrent episodes of binge eating and behaviors characterized in bulimia nervosa. Excuse me. So some of the DSM-5 changes to look forward to is for anorexia nervosa is they will be replacing the terms refusal with restriction and the term denial with persistent lack of recognition. Criteria A is rephrased to include markedly low body weight. Criteria B is going to say persistent behavior to avoid weight gain even though at a markedly low body weight. And D is amenorrhea will be omitted. And so some of the changes for the bulimia nervosa in the DSM-5 will include frequency for purging will be reduced from 2 times per week to 1 time per week, and non-purging subtype will be eliminated. So binge eating disorder will now be recognized as an official disorder in the DSM-5. And DSM-5 changes for eating disorder NOS will be replaced with a section classified as feeding and eating conditions not elsewhere specified. And criteria will include conditions that should be considered only if the individual has a feeding or eating problem that should be of clinical significance that does not meet the criteria for any other eating disorder. When you're looking at assessment tools, some of the 3 that kind of were the most popular one was structured interviews, self-report measures, and medical assessments. So 3 different interview tools for structured interviews were eating disorder examination, and that was a 33-item tool that measures behavioral and psychological traits in anorexia nervosa and bulimia nervosa. And B would be interview for diagnosis of eating disorders, and that focuses on differential diagnosis of anorexia, bulimia, and eating disorder NOS. And structured interview for anorexic or bulimic disorders, and that assesses for specific criteria for both anorexia and bulimia. And then the self-report measures, the 2 most popular are the first one, eating disorder inventory. And there's been 3 different revisions, and the most recent one is being with the eating disorder inventory 3. And then eating disorder examination questionnaire that assesses the severity of the eating disorder symptoms, severity of pathology, and associated disturbances in the past 28 days. And as far as the medical assessments go, I think it's just really important that we continue to have medical providers involved, and for that they will do blood counts, electrolyte battery, electrocardiogram, liver function tests, and then just continually monitoring blood pressure, pulse, and refeeding process of the patient. And then some treatment interventions that can be utilized are the most unpopular ones to treat individuals diagnosed with eating disorders are CBT and interpersonal psychotherapy, and hospitalization may also be necessary for the more severe cases, usually connected with anorexia nervosa. So that's all I have for you today. So I look forward to your questions regarding eating disorders, and thanks for listening.